now I was discussing about Dr. Zimmerman's you can say experience, which he shared with us in this ICAC conference on how this Maldi Toff is changing the world of microbiology. So he conveyed that his you can say in this particularly in this conference about the clinical benefits, or you can say achieving patients outcomes by simply using this technique. And his work mainly focuses on the time advantage, that is the time period that is covered during the whole period of the tests that are being done when a specimen is brought into the laboratory, right? So the time advantage was the main thing that was focused by Dr. Zimmerman, right? For example, he described if some years ago, if a patient has septicemia. Now septicemia is a very you can say deadly disease, right? It's an infection, or you can say it's a bloodstream infection. It is inside the blood and has a high chances, the patient has a high chances to die soon. And after a blood culture, you can say, and being analyzed in the instrument, and you can say one can come up with positive results, right? After many hours or even overnight, then one has to start from the blood culture model to grow bacteria, right? So to observe the type of the microorganisms that were inside that bloodstream, like E. coli or S. aureus, as I just mentioned earlier. So if it has grown, now he conveyed that if it has grown, then one can further, if the bacterial growth is there, if you found the bacterial growth, then one can easily you can say further progress the tests, or with the progress with the antibiotic susceptibilities testing, how to appropriately treatment should be given to that particular patient. So today with Maldi, you still need a blood culture to grow bacteria. That is the main thing, and the period it takes is about 6 to 10 hours, right? And bacteria can be identified in the blood culture medium directly from the blood culture by simply going through one step, that is centrifuging it, then adding some chemicals to it, and then shine a laser beam to it, and in the instrument will analyze it in few seconds, or you can say it will find out whether if it has got E. coli or any other microorganism, or even you can say less than 10 hours, or you can say you will be able to identify bacteria in the blood and treat the patient faster. And early appropriate therapy is most important thing to prevent mortality, right? And in this septicemia, typically in septicemia, you can say if you treat the patient earlier, your early diagnosis will help the patient to get recovered from this septicemia. So that was a breakthrough. Now, so the idea behind you can say that all is to treat the patient with the right drug at the right moment, right, and at the right technique. So here Dr. Zimmerman, he further unfolded the idea as this is a new technique, right? It has been in the, you can say, in the, it is present, but still it is new, right? So it should be confirmed by the conventional methods for confirmation. So dear viewers, both the scientists conveyed that it benefited their laboratories in which they have been working, and their workflow was greatly achieved as it is accurate and rapid and provided a lot faster results. And they conveyed further this technique to be very helpful and enhance their lab work results. That is one of the tests, you can say tests for many organisms can be done, you can say, or you can say one test for many organisms can be done. As since last 2 years, they were successful in identifications with mass spec. They've been constantly in touch with the mass spec, and they were, successful in dealing with it. And as it is, you can say, easy to perform, and you just load the specimen into it and you get the results. So Dr. Nancy conveyed that as it is very fast to train, it's very, even you could say fast or easy to train a technologist also, right? She added one more point, as she is also part of that conference in ICAC.